Good morning, members of the church and my fellow congregants. My name is MUREITHI, GEOFREY MUREITHI, and I'm here to talk to you about COVID. I know we are much more gone. And I will first remove the masks. I wanted you to see first how we wear it. Your mask should cover the nose and the mouth properly. And when you remove it, just hold one string on the one head with one finger, then place it somewhere safe for use another time. So in this case, I'll put it in my pocket. The last time we were here, we did COVID, and the churches and the congregation was closed, and all the gatherings were banned. And I hope this time we are doing COVID again, the same will be opened, and we hope for the best. Why should we be concerned about the COVID? We shouldn't be concerned about the COVID because of many, many things about it. We are concerned because it brought large gatherings were banned, economic challenges, social disruptions, many things including burden to health care, people working from home. But of late, we have been concerned about the COVID because people have taken aback. Many people do not believe there is COVID. Origin is known definitely. People do not believe about it. People are careless about it. That's why we are more concerned about it now. There are many myths about the COVID. That corona is man-made, it doesn't matter for now, and it's not. Origin is well undivided because it is said to come from an animal. And there are other myths like if you make garlic at home, if you do some drinks, you are okay. If you drink alcohol, you are sanitizing your throat. All those are myths that are not true. People who are well do not need a mask. That's another myth. It's not true. Everybody needs a mask. And some people are thinking there is no COVID. I don't know what shall we do, because for now, people have seen actually there is COVID. You have been told about people who have died. You know them now. If you knew nobody, at least you know Papa Siradura, if you knew nobody else. So do not wait until you know yourself so that you know there is COVID. There is no vaccine. That's another, what people are thinking there isn't. The mode of transmission all of us have been knowing. We know it's through people sneezing, coughing, exhaling, that is giving out air or letting air out, and we know human, from animal to human, now it is human to human. This virus also has another way of transmitting because it survives so much on tables, on indoor handles. Members, when we shall open the church for everybody, we shall open the doors, we shall sit, we shall hold touch where another person has touched. Those are areas we are now very concerned about, and that's why we are talking to you. And the funny thing about this virus also, it stays in services for a long, long time, so that I can be in the church in the morning, then you come in the evening, you touch the same service, and then there you are. That is why all those are modes of transmission. As we continue with the transmission, after you get the disease, transmission is how you do get the disease. After you get the disease, there are symptoms that we will get. And those symptoms are sneezing, difficulty in breathing, muscle pain, tiredness, general tiredness, fever. Of late, there has come another one. We are experiencing in the hospital people who are non-diabetic and getting high blood sugars. So you come to hospital without knowing your problem, without knowing it's COVID. We do your sugars, they are high, and that is, we have gotten that. Also, there is diarrhea. So there is a way it is infecting your GIT. The GIT is your intestines, your stomach. There is show of diarrhea. There is also non-symptomatic, like when we take people who are coming from accident victims. The end of the day, after taking them to surgery and everything else, you do COVID, it is positive. The severity of disease can be dire. You could get pneumonia, severe respiratory syndrome, kidney failure, diabetes, and even death. And note this, diabetes can give you COVID, And COVID can give you diabetes. You should note that. How severe is this disease? Mortality rate is 20 or 30 people per 1,000. That we are talking of 2 people per 100. COVID outbreak has claimed so many people, and that's our worry. And in Kenya, as per the day before yesterday, we were at 12,500, which is quite a high number. You can know, when we closed the gatherings and the church, we were at 1. And now we are at 12,500. So you can see what that means. The situation in Kenya is now what is making us concerned, because lockdown has been lifted. People are less careful. Why did we lift the lockdown? Because the government took some time to teach you and I how to prevent and how to do with the COVID. Now we know we cannot take the government responsible anymore. When Jesus was with his disciples, and he taught them very well, and he taught them how to teach, he told them, go therefore and teach others. So as we know now about the COVID, so if we know, that is why the government said, we have taught our people, Mutahi Kagwe has done his best, everybody knows, let us go and do. But now people, instead of thinking that the lockdown has been opened because we have the knowledge, they have become less careful, and that's why we are so concerned. Increased movements. The person who was gotten COVID positive yesterday from Tharaka-Nithi came from Mombasa. If there was still lockdown, this person would not have gotten it. So we were told we are given freedom. How to do with the freedom? It's for our own sake. And that's why we are also opening worship places. We are not opening worship places because COVID is not there, because there is less burden. We are opening because we cannot stay that forever. We have the knowledge. How to do with the knowledge? It's us. When you are baptized, when you get saved, you know who the devil is. So it's you to keep. The pastor cannot follow you everywhere. The preacher cannot follow you everywhere. You have the knowledge. And if you have the knowledge, you know what to do. There is need for caution. We are experiencing accelerated transmission. There are so many people now. Where we work in hospital, we are getting many, many people. We know of colleagues, we know of others, and that's why we are saying, please, members, let's take extra caution. We have people among us, because of science, because of the way our bodies are made, who are at a higher risk than others. And those people are the people the government are saying, please slow down, stay at home, kidogo, as things normalize. If you are younger enough, if you are less than 58 or 60 and older than 14, your body can fight many other things. So that's why the government, I'm not saying it is trying with you, it is saying you are stronger than others. So the groups at risk, we have already known them now. People with the comorbidities. Comorbidities is other diseases inside you. There are people with high blood pressure. There are people with chronic respiratory disease like asthma, pneumonia. There are people with diabetes. And you note diabetes here is becoming a common feature in the fight and the care of the spread of coronavirus. COVID-19 has been associated with high mortality rate among persons with diabetes. Please, members, if you know you have diabetes, please keep away. We have said that it can give you diabetes, corona can make you diabetic, and diabetes can accelerate and worsen it. Good news though, it is not all gloom in the country. 82% of the people suffer from mild form of the disease. You and I, don't be surprised, we could have suffered the same or we could be suffering. It is the people we are calling asymptomatic. Some may develop, 15% may develop around moderate disease, haitakuweza sana. 3% may be severely ill, and those are the people we have in hospital. And 2% may have to pay the ultimate price. Do not be the 2%, please. Ways of prevention we know. Avoid close contact with the people who are sick. When we open the church for worship, Stop the greetings. Some songs will now, I think, the mood. It may not happen another way. Give another one high five. It may not happen because we are living in an abnormal situation. Cover your mouth and nose when coughing or sneezing. That is normal. We have known that for now. Hands should be as clean as possible. The church leadership has provided us with washing places, washing areas. We will not follow you. The chairman, the leadership, the elders, the reverend will may not be able to follow you to tell you, please wash your hands. It is upon you. There is soap there the church has given us. There is good water. We have sanitizers. And if you cannot get sanitizers from the church, if you can afford it, it's cheap. Other than being admitted in an hospital, this is cost around $150. And there are many out there. Please have one and sanitize every time you touch a service. Like if, for example, I've just done that. I sanitize my hands because you teach as you do. Those are preventive. We have the masks. I've shown you how to do with the mask. If there is nothing you can do with your hands, we have been used to touching our ears, our nose, poking, touching our mouths, using toothpicks. Please avoid that. Disinfect frequently touched surfaces, remote your TV kwako, and many other areas. The microphone here, if you use and you are in the place on the worship, please let it be disinfected before the other user. At home, work or school, and when someone is sick and you visit them, please do the necessary. Sanitize your hands, wash with the clean, and you also in crowded places. When you pass Longai as you are going to town, everybody is without a mask or 90%. Be the exception of, please, put your mask. Members, what we are saying is the fear we have as a medical fraternity is the people who are asymptomatic. People out there, you are waiting for them to cough, they are not coughing. Actually, I do not remember the last time I saw somebody with a common cold because people are hiding them. People are sneezing in the bathrooms, and when they come out, they are smiling. People are doing all those things so that because COVID-19 has been stigmatized. People do not want to be known thereof. If somebody does the anacho, the one we used to do in the church there, everybody will move away. Members, we are opening the church for you because we love you, not because there is no COVID, because there is COVID, but because you now have knowledge. The church leadership has done the best. As the health workers, we also went visiting and we saw most has been done. So when you come in, please know we are living in the abnormal of the normal. Mutai Kagwe said, you can get it, I can get it. But I want to think now, would you change that to say, I got it, you got it, so that you treat everybody as a suspect. As in hospital, we have seen all this. We are dealing with them on a daily basis. Do not wait to see somebody because that somebody should be yourself. All those rules that were there before the COVID, let's put them into consideration because it was opened for you to go out there and to know what to do. When you go out there, when you go for self-service, when there is a party, you don't eat everything. If you have sugars, you know yourself. If you have hypertension, you know yourself. If you are obese, you know yourself. You know what to pick and not what to pick. The same way in this COVID era, know what to do and not what to do. Thank you, members. We hope you will put that into consideration. The board is doing so much for you. The church leadership is doing so much for you. In the case of questions, please be ready to ask us when you meet us. We are also happy that you are praying for us because we are dealing with those people on a daily basis. And that's why you may sometimes not see some of us in the church because we don't want to come and put you into risk. If you have, you have risky or you have gone those areas, please do not. If you know you are coughing, don't come to church. It's not going to infect somebody else, and we shall have a very healthy community. Thank you very much. We are there for you, and God bless you.